Okay. Could I ask everyone in the room to, if they are on their computer, to mute their microphone? So hello and welcome to everybody who is in the room here in Geneva and online, and welcome to the workshop on how to build a health commons approach. My name is Michelle Childs. I am the Director of Advocacy here at DNDi, who is one of the co-hosts, along with the Institute for Innovation and Public Purpose at UCL, and also the Friends of the Independent Panel. I will be your moderator today because unfortunately Springomi from Market Access Africa, who was going to moderate, is unfortunately sick. We wish her a speedy recovery, and I will try to fill her very big shoes. What we are seeking to do today with this workshop is it's the start of a conversation and a contribution to many conversations that are happening now about how to build back better for pandemic preparedness and response, recognizing that we are still, in many parts of the world, still dealing with COVID. So the workshop today will be about 2 hours, and we have a really great lineup of speakers from both political, from academia, from organizations who are seeking to implement R&D, and from civil society, reflecting that we need all people to come together to try to explore what the key elements of a collective framework to organize, finance, and coordinate health innovation needs. So we'll be discussing some of the latest economic thinking, exploring some of the ways in which people are trying to implement some of these principles, and to identify areas where policymakers can and should take action. This is part of a series of workshops, and as I say, it's the start of a conversation and not the end, and we hope that you will participate both today and continuing from that. Before I turn to our first speaker, just a few housekeeping moments. First, to say that this meeting is being recorded, so if you don't want to be recorded, then now is your time to leave. But also you can follow up and track on this. In order to keep time, we won't spend a lot of time introducing people and going through their bio in detail, but it will be online, and I urge you to look at their bio and the work that they have been doing. This is a hybrid event, so we have some people here with us in Geneva and many of you in different parts of the world. And we're hoping that although we have some initial presentations, that we will also have an opportunity to be able to share questions and comments. If you would like to do so, please can you put your questions in the chat, and we will come back to that. As I've mentioned to those who are in Geneva, we've got a slightly sensitive mic, so they will be holding their enthusiasm while people are speaking, and then we will go in to have a conversation. So if she is online, do we know if she is here? We are due to start with the Right Honourable Helen Clark, who is the ex-Prime Minister of New Zealand, but in this context is really speaking in her role as one of the co-chairs of the Independent Panel on Pandemic Preparedness and Response. Is Helen with us? It looks like, as with all of these hybrid events, there's a little technical challenge. So I wonder if that is the case. I wonder, Mariana, would you be, Professor Mazzucato, would you be willing to come in and to start your presentation? I think
Helen has just joined. Sure, but I think Helen has just joined. And I think, yeah, there she is. She's here.
Lost. Bear with me. Helen is joining us. Yes. Now you can tell it's a live event, which is good. Thank you very much for joining us. Are you ready to share some introductory remarks with us?
Yes, I certainly am. I was online, but I was.
You're on mute?
No, I'm not on mute. Are you hearing me?
I can hear Helen very well.
We can all hear her.
Mariana.
Hi, I can hear you.
We can hear you now.
Okay, everyone hears me? Great. I'll fire away then.
Does the Geneva office here in the big room?
Would you like?
Geneva, are you hearing Mariana and me?
I'm afraid we are unable to hear you. Are people online able to hear, or is it something that's just in this room?
We can hear.
We can hear.
Okay, so it is unfortunately an issue of people in this room. We're having an IT person to come here. I'm very sorry, Helen, to be. Yes, I'm sorry to interrupt you. Helen, please continue while we try to resolve it in this room here. My apologies for this.
Okay, or otherwise we wait until everyone can hear us.
Now we can hear you. My apologies. I think this is what we all have to deal with in the benefits and the downsides of online communication. So please, over to you. Thank you very much.
Well, thanks, Michelle, and greetings to everyone who's joined for the start of this incredibly important conversation. As we're all so painfully aware, we're entering year 4 of the current pandemic, and we continue to see how inequitable access to diagnostics, vaccines, and therapeutics continues to be. Not only the experience we've had with COVID, but of course in recent times, we've seen the Ebola outbreak in Uganda, which is now reported to be over, which is good, but it did not benefit from access to vaccines, which did exist, but had not at that point been trialled. We can also note that Mpox went largely unnoticed by most until it began to spread globally, and then, hey presto, vaccines were available in the higher income countries. So going back to the work of the independent panel on pandemic preparedness and response, which I co-chaired with Ellen Johnson Sirleaf, we warned about such inequities at that time and made a point of saying that we need better approaches going forward than what we have had. We observed that the model of development and delivery of vaccines, diagnostics, and therapeutics for pandemics simply is not fit for purpose, observably not fit for purpose. And we said it was important to shift away from a market-based model to one based on a global public commons. And now, of course, we're moving to the terminology of the global commons approach. We said that without a shared vision, that pandemic countermeasures could be considered as a global commons, the business as usual approach would continue to fail lower income countries, leaving them dependent on the goodwill of donors and on charity. And alas, that's been the experience of this current pandemic. So in our report, going back close to 3 years now, we said the world needed a pre-negotiated end-to-end global platform for vaccines, diagnostics, therapeutics, and essential supplies. We said innovation shouldn't be left to the market, but should shift to this different model that can deliver a global common goods approach. Now that Act A, the Access to COVID Tools Accelerator, has been evaluated and, shall we say, has shifted to a quieter phase, many discussions are underway on what a future pathway for countermeasures could involve. And there will be a range of different views on that, we know. But I think what is clear to many of us is that the status quo market-based approach isn't going to work, won't work in future to stop outbreaks from spreading and becoming pandemics. So, in order to protect people everywhere, we must learn from the past. We have to be supportive of emerging ecosystems fit for the future. We need solutions that ideally can be agreed by stakeholders and can actually be implementable. Former members of the independent panel together with leading researchers, including Mariana Mazzucata and Els Toril, who are with us today, are digging deeper to determine what this new approach could look like. And a series of publications and activities are underway. To contribute to that discussion, a number of us put our names to the comment in The Lancet published last week. And it proposes 6 essential building blocks for a new system, premised on equity from beginning to end, and on cooperation, shared technology and know-how, regional resilience, and a global commons approach overall. So this workshop, and at least one more in the next month, the next one on technology platforms on the 2nd of February, are designed to help us to share ideas and build on them to design a new approach. Then in mid-February, I'm with others convening a meeting at the Bellagio Centre to focus on developing an action plan which could help bring about this end-to-end ecosystem for pandemic countermeasures. And we're engaging participants from around our world to bring their ideas and energy to the agenda. And we will report back out of that meeting with the aim of sparking action in 2023. We understand there are also efforts to bring national political leadership together to think through the governance and financing issues. Other processes, of course, are also underway. We have the pandemic instrument discussions with the WHO-WHA intergovernmental negotiating body, and it could potentially agree principles and the broad rules which would govern an end-to-end ecosystem. At the UN General Assembly in September, there's scheduled to be a high-level meeting on pandemic prevention, preparedness and response. And out of that should come, we hope, it will take a lot of heavy lifting, but could come, a concise, action-oriented political declaration, which could give direction on issues like this to try to push forward a pre-negotiated, equitable end-to-end system with a global common lens. So those are my opening comments. And obviously we look forward to lively presentations today. And we're going to hear examples about how many of you are taking forward this kind of approach in your work. Mariana will follow me and will certainly enrich our knowledge and understanding of the global commons concept and how to move forward. I just want to thank everyone again for making the time to be with us today, because to go to Bellagio, we need to be well prepared. And this is a workshop designed to help us to really make the most out of the opportunity we have to work on this in detail. Back to you, Madam Chair.
Thank you very much. And I think have set us both an inspirational but also ambitious agenda for the discussions today. And I think it's particularly worth pulling out things like the status quo is not working. We need to build something that is fit for the future, that has equity at its heart, but is also actionable. So as you prefaced, we are now turning to Professor Mariana Mazzucata, who is the founding director of the Institute for Innovation and Public Purpose at the University College London, and also chair of the WHO Council on the Economics of Health for All. And Mariana will be sharing with us some of her latest thinking on achieving health for all. Just to note that Mariana is only able to stay with us until 3 p.m. Geneva time. So what I suggest is that if Mariana agrees, we take a little bit of time at the end of your keynote if there are any clarification questions. So while you're listening to Mariana, if you have any of those questions, please put them into the chat. So Mariana, if you are ready, over to you.
Thank you so much. Sorry, I just did some chaos on my screen. So thank you so much for, first of all, for organizing this. Thank you, Helen, for agreeing to attend. We all know you're super busy. I'm actually trying to liberate myself so I can stay longer. We're trying to move things around, but I'd be very happy to answer questions immediately after the presentation. I think I'm allowed to have about 20 minutes. I'll try to do less so that we can have the most discussion possible. So really what I want to focus on is how so many of the problems that we're facing on the back of COVID-19 and what we've learned of just how badly prepared we were globally, and I frankly don't think we're any more prepared now than before, are embedded in the way that we actually think about the role of public policy. It's too much in terms of just kind of fixing market failures. Even the notion of the public good has been framed within economic theory as though it's a market failure fixing problem. So we're kind of designed to fail. We're not failing by chance. And we know this. We are going from crisis to crisis to crisis, and we're always in reactive mode. And even when good things happen, they could have happened in such a better way if they had actually happened ex ante and not ex post. And so this idea that, at worst, government get out of the way, the kind of Reaganite, Thatcherite, neoliberal view, that's not really the problem right now. The problem is that at best, we think about the good role of government in terms of filling the gap, right? Whether we have positive externalities due to the public good characteristics of problems, and we need government to come in and fund something, whether it's funding basic research, health innovation, cleaning water, defense systems. It's basically filling the gap of something the private sector is not doing. So it's a correction. It's not an objective. The opposite of that, of course, are negative externalities. The reason we need things like carbon taxes to fix the negative externality problem. We need funding for small, medium enterprises because of the information asymmetry, another type of market failure. We need Keynesian economics, which has been framed in terms of market failure, even though Keynes meant something much more due to coordination failures. So it's not that these failures don't exist. It's that the idea that somehow the market is out there and it works incredibly well, and every now and then screws up, and that's the role of government. That's the problem. So the market failures, of course, exist, but if we're always then tinkering and fixing those market failures, it's absolutely impossible to actually have transformational change. So if everything was fine and we just had needed to fix little things on the side, then actually that approach would be fine and we could put bandages here and there. If actually our system, our capitalist system, is not producing inclusive growth, is not producing sustainable growth, and is actually making both planet and people sicker, then we need transformational change. And COVID-19 completely woke us up to this in theory, not in practice. We were unprepared in terms of personal protection equipment, which is not rocket science, but that, as you all know, was where most of the deaths, at least initially, happened in terms of frontline workers. We then called them essential workers, but didn't actually treat them or value them as essential. Just witness what's happening in the United Kingdom now with the massive austerity again to our National Health Service, with all the nurses and doctors on strike. We failed on the test and trace system to the point that even advanced industrialized countries like the UK ended up outsourcing test and trace to Deloitte, a consulting company. My new book's actually on the history of consulting and how it's an absolute failure in terms of kind of reducing government capacity because we've outsourced the brains. We failed on the digital divide. We know that the lockdowns just increased inequality because so many young people around the world stopped accessing their human right to education. And of course, one of the biggest failures, which we just heard about, was we didn't deliver on the actual mission around the vaccine, which was to vaccinate the world. The mission is not just to have a bunch of vaccines, we've got 8 of them, but actually to, mission accomplished would have been vaccinating the world, and not what Dr. Tedros calls vaccine apartheid, where something like 80% of vaccines were hoarded by 10% of countries, vaccine nationalism, so on and so forth. And, on here, I'll come back to this, or if I remember to, but we should also be very careful when we talk about this problem. And it's really important to go with a magnifying lens at the project level of what happened, what went wrong. The AstraZeneca vaccine, forget about the actual science, science always, we learn what works, what doesn't, but in terms of the collaboration, the public-private collaboration between AstraZeneca and the Oxford University researchers, which are publicly financed, as you know, every university basically in the UK is publicly financed, was very different from the Pfizer vaccine. There was agreement on the cost, on the prices, on the sharing knowledge, to a level that was extremely different from the Pfizer one. So I really recommend that all of us, when we think of the problems that we'll be talking about today go beyond the kind of public, private, or business state and say, which business? What did we learn from when we looked at the way that a particular public-private collaboration, partnership, ecosystem worked? So ecosystems can be parasitic. They can be predator-prey, right? Any biologist will tell you that. What does it mean to actually design a mutualistic, symbiotic ecosystem and not a parasitic predator-prey one? And for that, we need to really look at the details of these collaborations and learn to kind of scale up good examples. By the way, this People Vaccine Report, we wrote this in 2017. It's available online, and a lot of, my institute, along with some other collaborators, a lot of the principles actually that we're writing about today on the back of the COVID moment were already in that report back then. And there's something about just remembering that so many of the problems that we're talking about today on the back of the COVID-19 lessons have actually been around for a very long time. And this is simply then the moment for change to happen. But what we're talking about today is, is stuff that a lot of us, I know Benjamin Coriat is here, who I've learned from so much over the years, and his work on the commons is so important. So I think we should also talk about political strategy, because a lot of us have been saying these things for a long time. So in an area like vaccine production, but also in terms of renewable energy, also in terms of the digital divide, these are problems that are complex problems and that absolutely require collective intelligence, collaboration. And really what I want to be talking about today is that to have that collective intelligence, the design of that collaboration needs to reflect these kind of common good principles. Otherwise, we get stuck in all this sexy language around common goods and collective intelligence and ecosystems, but then the design of the intellectual property rights, the design of the finance, the design of the conditionality linked to a loan or a grant don't actually embody those principles. So how can we, kind of get very serious about this? So I've been writing about these issues for a while, and I only put this up here not for self-promotion, but just to say there's lots of different issues to unpack. I'm going to be focusing more on some of the recent stuff I've been thinking about, how the mission-oriented, outcomes-oriented approach can be quite useful for some of the problems that we're talking about in terms of really designing into the mission, so the outcome, but especially the collaboration, these ideas of actually building a symbiotic, mutualistic outcomes orientation. But for me, at least, it came from when I started to really think about the role of the state outside of this market failure fixing, more around market shaping and co-creation. Because Helen's right, we shouldn't be marketizing these ideas, but the real problem is how we have framed the market itself. So it's not always about saying some processes need to be, in the market, some not in the market. It's also how do we define and shape the market to actually deliver on the kind of outcomes that we at least talk about, like the Sustainable Development Goals, 17 really ambitious goals, 169 targets. There's no way that we're going to reach that either through charity or through one actor doing things on their own. How do we really embed that collective intelligence? And on the state side, it means instead of thinking of state investment as like a lender of last resort, what does an investor of first resort look like? What does it mean to help really direct and help steer an economy, but really allow a lot of bottom-up experimentation amongst lots of different actors? On the value side, what does this actually mean for how we think literally about co-creation of value and value in the economy? So it's not always that the private sector is creating value, Pfizer is creating value, and the government there is regulating, administering, redistributing, facilitating, de-risking, enabling, all this kind of bullshit terminology that we've all bought into, which definitely affects then the energy in the room. If you're just an enabler or a market fixer or a de-risker of who? The risk takers in the private sector, you're set up to fail. So a lot of the words that a lot of us use, like de-risking, enabling, facilitating, and fixing market failures, part of the process of going to this new kind of, dynamic that I think we all need is really also realizing how much of the vocabulary itself that we're using, even in the good stuff that we're interested in, is problematic. And in this World Health Organization Council on the Economics of Health for All that I chair, we have 11 amazing women from all over the world, all 5 continents part of it. Marilyn Waring from New Zealand, Vera Songwe from Africa. She was until recently running the UN Economics Commission for Africa, Jayati Ghosh, Stephanie Kelton, Kate Rayworth. Anyway, what we've been trying to do is to say, if health for all is the goal, vaccinating the whole world and not just having a bunch of vaccines that end up with a vaccine apartheid, what does it look to actually design the economic system to deliver on that? So it's different from saying invest in health for all because it's good for the economy as well. That is a good point, and we should always show that multiplier effect. Cost of inaction is greater than the cost of action in health and in climate change. But to go to the next step, if we care about these goals, again, the SDGs and specifically different goals around health for all, what does it mean to design intellectual property rights, design our financial system, design our procurement system, design our budgeting, so outcomes-oriented budgeting? All these things can be designed to actually deliver on goals, or they can just do what Keith Pavitt used to say at my old institute, sprue, pissing in the wind, technical word there for just kind of spreading out a lot of stuff, which then comes back and in your face because it's not working. So governing health for the common good, purpose-driven innovation, reshaping the intellectual property rights so they're not so wide, just used for strategic reasons, not so strong, hard to license, not so upstream. So we're actually privatizing the tools for research, something like that Dick Nelson has also been talking about for a long time, but really shaping that knowledge governance, including the intellectual property rights, in such a way that we're actually thinking of the goal first and then designing those tools after. Reforming corporate governance. We know that maximization of shareholder value has led to really dysfunctional behavior within the pharmaceutical industry. Pfizer, I've been writing about Pfizer around this problem for more than a decade. I've even told my husband if I don't come home at night, it was Pfizer. They're one of the biggest share buybackers in the world. Companies like Pfizer and Exxon, the Fortune 500 companies have spent over $6 trillion in the last 10 years, that's 12 zeros, just on buying back their shares to boost their stock prices, stock options, and executive pay. That's not necessarily the corporate governance model we need in an area like health innovation. Reinvestment of those profits into the real economy, helping to direct those investments in some of the areas with greatest need, and making sure that the business model itself is the correct one, so we don't have to correct things afterwards, patching things up, whether it's through the state or philanthropies. That really has to go to the corporate governance issue. There's lots of talk about stakeholder value and not shareholder value, but we've seen little walk around that. And if you can't walk the talk of stakeholder value during COVID, when will you walk that talk? Building resilient and diverse manufacturing capacity so vaccines can actually be produced globally, so we don't have to rely on this kind of philanthropic mindset. That's also about really making sure that knowledge governance system is not producing all the rent extraction and privatization of knowledge. Introducing conditionalities to any sort of public investment. It's amazing that the National Institutes of Health in the United States, they put in more than $40 billion a year around drug innovation with no conditionality whatsoever. Even just a conditionality that those companies most benefiting from those 40 billion a year of taxpayer money won't use their profits just for share buybacks, so on and so forth. That's kind of ground zero conditionality. But surely things like prices of drugs reflecting that public contribution, again, intellectual property rights not being as strong as they are when we have those public investments. These are all kind of big issues, which again have been around for many, many years, but this is definitely the wake-up call that this is a huge problem to solve now if we're going to solve if we're going to be more prepared in the next pandemic, and definitely strengthening the capacity of the public sector. And passing, I mentioned that the UK government outsourced test and trace to Deloitte. Well, this kind of outsourcing of the brain of the public sector is actually something that even NASA was aware about during the Apollo moon mission. The head of procurement back then, Ernest Brackett, said, if we continue to outsource a lot of the governance capacity of NASA, we're going to end up getting captured by brochuremanship, he said. If you hear a strange noise, it's that I have a blood pressure machine taking my blood pressure for 24 hours due to some screening. It's not me farting. It actually sounds like a fart. I'm sorry. I'm being very inappropriate. Okay, anyway, strengthening the capacity of the public sector is absolutely critical. if we want to govern the ability of the public sector to work alongside the private sector. And what Ernest Brackett was saying back then was that NASA wouldn't even know who to work with in the private sector if they stopped insourcing, and they wouldn't know how to write the terms of reference, literally the deals, which back then, by the way, they were very ambitious on. They even had no excess profits in their clauses with the private sector. Fascinating history of NASA. They no longer have that, by the way. Anyway, so what is the difference between this kind of fixing of the public good problem versus having an objective oriented common good framing? That's the first difference. One is a correction for the lack of private sector investment. One is actually about co-creating an objective. What do we want to do? Vaccinate the whole world? That's an objective. It's not about correcting for something someone else hasn't done. How do you achieve that? It's not through market failure fixing. It's through actively co-shaping and co-creating the market. That means actually embedding that idea in the tools. So outcomes orientation, a lot of focus on the process. So along the way, if we need collective intelligence, that means that the way we're actually, getting to the mission matters just as much as the mission itself, as the target. So the process along the way, all the details, all those different contracts need to embody that common good approach. Collective interaction means, yes, we need a direction. We need to be thinking about what the outcomes is, but have as much bottom-up experimentation and a sharing of the knowledge along the way. But what does that actually mean? What does it mean to have a process that is actually steering on a direction, but very open on the how? So what I want to talk about in my remaining 5 minutes is simply, what does it mean quickly for policy design? I've already said a bit of this. What does it mean for institutional and kind of tool design? What does it mean for sharing the rewards and issues around co-creation and participation? I'll probably just give you a little flavor of some of this. I already mentioned that, we would have never gone to the moon if we thought about it just as market failure fixing. They were very ambitious around the outcomes, very ambitious on the collaboration along the way, very ambitious around the outcomes-oriented tools like procurement. So what I've done in recent years is work closely with different entities like the European Commission. What you see here is saying, well, why don't we learn from that kind of moonshot approach? Collective intelligence, very ambitious outcome, lots of different sectors getting involved along the way. Instead of just giving money to the pharmaceutical industry, focus on what's the goal we're trying to reach and really help lots of different sectors. In this case, whether it's pharma, biotech, materials, sustainable materials. God, this sound is terrible. Sorry. And how do we really embed that kind of cross-disciplinary, cross-sectoral, cross-actor approach, public, private, third sector, and drive those multiple bottom-up solutions along the way? The way we, tackle any of the SDGs, this is just some examples around climate and clean oceans. The main point here is you start with a challenge, you turn it into a concrete mission with a goal that you can actually say, did we achieve it or not? That goal should be wide enough that really embodies interaction between many different industries, precisely so we get that multiplier effect that Keynes really worried about. So it wasn't just about counter-cyclical government spending. It really was about catalytic change, transformational change. And these sectors that we get involved, how do we really catalyze that kind of bottom-up experimentation along the way by actually producing conditions, right? So an example of this would be in recent years where Germany has had a very clear mission around its energy strategy that actually then affected how its public bank worked with a sector like the steel sector, which globally is having a problem. In Germany, because it had a clear mission around sustainability, the loan to the steel sector was conditional on the steel sector lowering its material content, which it then did to repurpose, reuse, recycle technology. So conditionality, which is both kind of clear on what the outcome is, but open on the how. So the steel sector wasn't told what to do, but it had to change in order to get that public loan. This is just some other examples that we've been working with that come on the left there from the UK industrial strategy, where we tried to move it away from its old approach to the life sciences strategy, saying really the point here is not just to say more money to a particular industry that we consider a top industry, but really helping that industry transform and change in order to reach a public goal. And so again, this idea of market shaping, it's about redirecting finance, being clear on how do you govern something like intellectual property rights, outcomes orientation to tools like procurement and budgeting, but also eventually, because the treasuries have their, have the money, really making sure that the treasuries themselves, the ministries of finance, can actually evaluate whether they, the public investment is worth it or not, outside of these very static processes that they currently have around cost benefit analysis and net present value, but really making sure that they're able to capture those dynamic spillovers along the way, which is what the kind of public interest test should be measuring. I mentioned that NASA, they wouldn't have gone to the moon without outcomes-oriented procurement, but they actually had to change how they did procurement away from this kind of parasitic cost-plus contract towards a more challenge-oriented fixed price contract with incentives for quality improvement and innovation. So anytime the pharmaceutical industry says, oh, but any sort of meddling is going to kill innovation, this is a sector that's receiving huge amounts of public grants globally. The real problem there is that the way that we've actually designed those grants, again, with very little conditionality, the public investment is huge there. There's a lot of public risk taking, but we haven't really thought about how do we share both risks and rewards along the way in terms of the conditions that should be attached, as I mentioned, to pricing, to intellectual property rights. But there's also no reason why we shouldn't have kind of a more challenge-oriented way of thinking about the interaction between the public and private. And this is really just the point here, my last point, which is that a lot of this is about building a new social contract between the public and the private sector. They're both equally important in this sector. Also philanthropies, whether it's the Gates Foundation and so on, but even there, huge problems, as we know, with how the Gates Foundation itself has not upset the current problems around the intellectual property rights system. What's interesting, I literally will finish in 30 seconds, with COVID-19 is that what we saw, though, was some countries really kind of embracing this moment as an opportunity to change the social contract. So this is the Minister of Finance in France, where the loans provided to Air France and Renault were conditional on those sectors, those firms reducing their carbon emissions. Whereas in the UK, we just kind of gave money away to EasyJet, 600 million, no conditions attached. All of these really mean, this is not about sticking to the old way of thinking of the market and the state there just to kind of regulate, make things a bit better and fix markets, but how do we in a pre-distributive way from the early phase really get those conditions right so there's a true deal. And this is about talking about access, directionality, profit sharing, also conditions on reinvestment, in a much more explicit way from the beginning, as central to the design of those relationships. This is just an example of how we've been talking about it with the Biden administration right now, where they have this CHIPS Act, which is going to be another giveaway to, Intel type firms. But this is really an area where we should, health is like the most quintessential area. And just lastly, with Elsa's leadership in the council, we're thinking of, for example, how to use the mRNA hub program as an example, again, on the back of the COVID-19 lessons, how do we from a very early stage in thinking about the collaboration between public and private, get all these issues right from the start? And I truly believe that the only way to do that is to bring forth this common good approach, which people like Benjamin and others have been thinking about for many years, but really embed it into the design of those public-private relationships through a network of different actors where how they work together embodies these principles instead of what we have now, where we bring these principles at the end and then we rely on the redistributive and kind of market fixing model. So let me just stop there. I'll just finish with saying, as I said, this is all about changing also the story of how innovation comes about, because otherwise the pushback will always be from the industry that this is going to kill innovation. So thank you so much. Sorry if I went over by 2 minutes.
Thanks very much, and a lot to take in. I just want to point out to people, and you've mentioned, Mariana, in your speech, there's a lot of work that is accessible online. Also, a new paper that you have produced, which I hope somebody has put in the chat, so that people can have an opportunity to dive into this in a deeper way. I think a couple of the things that you were talking about, we will hear a little bit further from others, in particular the MNRA hub, and obviously, as you mentioned, Benjamin will be talking about it. But we've had a couple of questions in the chat that I wanted to raise with you. One is in relation to your comment about redesigning and looking at the way in which countries and others finance. We have a question here which is saying, could you just bring this down for me? Thank you. What do you think the role is for development banks in particularly in developing countries, to try to look at the way that they finance innovation in this space?
It's a great question. By the way, Sarah has just put a recent paper on the common good, which has a lot of the stuff I've been talking about, and I'm happy to share the deck as well. So development banks, in theory, are part of the solution, and practice can also be part of the problem. So in Italy, we have a development bank, Cassa Depositi e Prestiti, and it's part of the problem. It's just giving out money to industries that are yelling for help, including the steel industry. But in any country that might also have an active pharmaceutical industry, it might be getting some support from the development bank. But if there's not conditionalities attached to those loans, we have a problem, and it ends up just in that kind of de-risking mentality. Right. So a development bank will often be an investor of first resort, not just a lender of last resort. So that's already a risk, that the bank is taking. What is the right deal for that, public risk taking? Well, surely there should be some sort of public interest test. Under Lula, in Lula's first administration, it was really interesting. The BNDES, the Brazilian public bank, started to change how it was thinking. So the generic sector, generic drugs in Brazil, were increasingly being bought out by large global multinational corporations, and they asked the bank for support. And because the goal in the Lula administration was inclusive growth and innovation-led growth and sustainable growth, the message kind of came down into the design of some of the loans. And in that case, I remember it was very interesting. The condition was that these generic producers also had to think through the access issue. And so the idea that, a pill, an antibiotic, would not be produced in a way that people had to take 5 pills a day, which would be very hard with people with difficult lives, say living in a favela, but 1 pill a day. I mean, it sounds a bit micromanaging, but it's why not, right? If you have a generic industry asking for public support, what are the kind of conditions that might be attached to make sure that that public support is in fact creating public value instead of just saving the ass of an industry, right? So I think the role of the development bank is to provide the finance that's needed, but always with conditions attached that meet some sort of public interest test. And that example I gave of the German KfW, its public bank, making the steel industry loan conditional on reducing their material a composition of production along the whole supply chain of steel production. That's a great example. Whereas just giving out money to industries that lobby their way up the chain because they're considered a top sector. So I think this issue of conditionality is very important for development banks.
A couple of other questions, and then we'll move on. I think some are asking you the biggest question, which is how do you make the political steps? And I think that I'm not going to ask you that at this stage, because that's something that I think we will need to explore. But I think that there is, one of the clear questions that's coming out is that we know from COVID that, particularly when you're talking about financing, you're talking about countries, there is a very nationalistic focus, and you're talking about a collective approach. So how, and a lot of funding at the moment comes from the north. So how do you feel that, what economic case do you think can be made for a collective approach? And secondly, we know that there are concerns in both north and south countries about taking action to change the market conditions for pharmaceutical companies, because they believe that that will undermine innovation. So on both of those points, what do you feel is the case, particularly economically, for countries to look at a more collective approach and also to change the contract with pharmaceutical companies?
Sure. So, I mean, I would say that political question actually is incredibly important. I was really surprised that, the Obama administration had no narrative whatsoever to talk about their role with Obamacare. And that is actually about the political narrative. So you'll remember that the pushback from the Tea Party at the time. I don't know where they ended up, but it was that, don't mess with the system, right? You're meddling in healthcare. In the pharmaceutical industries, reaction is often similar. Don't meddle in the system. That's going to hurt innovation. The reaction, and it was just so interesting because this is the US government that's actually investing a huge amount of money, let alone the countries where we kind of would like more public investment. This is a country that is making the public investment, but has no narrative, let alone the conditionality. The response by the Obama administration with that pushback on what they were trying to do was a very classical social democratic response, which is important. It was, 60 million people are uninsured in this country. Of course, this is the right thing to do. It wasn't debunking the language that was coming back, which was meddling. What should have been said before the social democratic response was, meddling? What are you talking about? 75% of new molecular entities with priority rating in the US are government funded. We're not meddling in a system that's created by the pharmaceutical industry. We're getting the right deal. The taxpayer has helped fund it. What's the right, governance system to make sure that the prices, the intellectual property rights, the insurance, and so on is actually in the public interest, given the public investment. And to be honest, without that first kind of ground zero narrative change, the rest does not follow, because we will always be catching up to the discourse and the storytelling of where innovation comes from. In terms, and so that kind of tackles both the political and the pharmaceutical bit. In terms of the global, this is where we really need to, and I know both Helen and some of my friends like Jyoti Ghosh are working with the UN on this, but we need a new form of multilateralism. We need the WHO, the World Health Organization, and other such organizations around other grand challenges that we have to be not only strengthened, often they're underfunded, so they definitely need the money, but really have an explicit remit to be, governed and working towards these kind of public value and public interest goals along the way. So, at a national level, that would have been, I think, something like the NIH should also be not just putting money in, but making sure that we have the access at the end. We don't often have that nationally, except when it's war. When we have a war, believe me, the public investment is governing the process. So even with defense, the US government funds health because soldiers get sick on the battlefield. When it's DARPA or other bits of the Defense Department that fund health, they are so strategic, they're not stupid. They make sure that the soldiers on the battlefield have access to the medicines that the Department of Health, co-invested or procured in through the private sector. When it's the civil society social NIH type organization around the world, that outcomes orientation doesn't happen and the deal making along the way doesn't happen. That's why with COVID, it was so interesting that the Defense Production Procurement Act, which was set up for a wartime, the Korean War reason, came out because millions of people were dying, right? So they used a wartime tool to deliver on a more societal goal. But so we're actually having to wait for war or millions of people dying in a health pandemic for government to get smart and to do what it does in war. And so really the challenge here is the common good approach. In a war, we're worried about winning the war. With these social problems, we don't actually ask ourselves, what does it mean to win that problem? Again, vaccinating the world is the mission accomplished. Backtrack and get all the tools to deliver on that goal. But that's both at a national and an international level. And the collective intelligence that we need globally so we don't get vaccine apartheid really does require then an explicit remit for these global organizations like the World Health Organization to help govern these processes instead of just being on the periphery, and kind of allowing the pharmaceutical industry to govern the rhetoric and the design of the tools. Sorry, I think you're either on mute or I don't hear you.
Sorry, this button goes in and out. So thank you for that. Obviously, we'll continue this discussion, but I wanted to now bring in, you mentioned the importance of having experiments. And I think that, sometimes these discussions can seem to be for the future rhetorical. Is it possible to do some of these things? And I think what we wanted to do now is to turn to representatives from 3 organizations who are trying to deliver, they may not call it common goods, but they are certainly seeking to deliver an open approach to the development of vaccines, treatments, and diagnostics. And I think that we will have the opportunity here to hear both the opportunities that they see from that approach, but also some of the challenges. And I think that both of those are issues that we need to concentrate on if we're trying to take some of these ideas to scale and to prepare for the future. So could I turn first to Chan Park, who is the Medicines Patent Pool's General Counsel. And hi, Chan, thanks for joining us. Please, I think, Chan, you're going to share with us some of your experience, your organization's experience on the management of collective knowledge within the WHO mRNA Technology Transfer Hub. So Chan, over to you.
I'm currently trying to figure out how to share my screen. I think I got it. Excuse my voice. I'm getting over a cold, which is part of the reason I'm not there with you in person today. Can you see my screen?
Yep.
Okay, great. Thanks, everyone, and good afternoon. I'm going to spend a few minutes talking about the IP sharing provisions that are contained in the technology transfer agreements that are part of the WHO mRNA Technology Transfer Program. Now, many of you know that the key objective of the mRNA Hub is to improve the health security in LMICs, in particular in preparation for future pandemics, by building mRNA vaccine manufacturing capacity in low and middle income countries. The 3 principles undergirding the program are 1, equitable access to the sharing of intellectual property, and 3, the sustainability of the technology recipients. I will obviously focus on principle 2, the sharing of intellectual property, but I will touch upon the other 2 principles later on in the discussion. So the basic idea is for the hub, Afrigen in this instance, to develop the mRNA technology in collaboration with the experts and make it available to the selected spokes, who will then take the technology and invest in a sustainable model to commercialize any products based on the platform. And the rights and obligations of each spoke are defined in a technology transfer agreement between each spoke and the hub, each spoke and the Medicines Patent Pool. So of the 15 spokes that have been selected by the WHO to date through its expression of interest process, 10 have already entered into a technology transfer agreement with the Medicines Patent Pool, and the 5 should follow shortly this year. It should be noted that most of the spokes, not all, but most, are private for-profit entities that have indicated a willingness to invest their own capital in building a sustainable model once the technology has been transferred to them. And the technology transfer agreements that I mentioned will lay out the various obligations of the parties, with a key component being around the sharing and management of intellectual property. And I should mention here that the technology transfer agreements, as well as other hub-related agreements, are all available on our website at the link indicated at the bottom of this slide. So here's a high-level summary of the IP-related provisions in the agreement. With regard to freedom to operate, given the geographical diversity of the spokes, 15 of them scattered across 4 continents, and the rapidly evolving mRNA patent landscape, neither MPP or WHO is in a position to make any kind of guarantees with regard to freedom to operate at the country level. But what MPP does and will continue to do, however, is to provide updated IP landscapes and analyses to assist each spoke in performing its own freedom to operate analysis. Now, in connection with the technology transfer packages that are made available to each spoke, MPP grants to each spoke a royalty-free, non-exclusive license to the technology to develop and commercialize any products based on that technology. In addition, MPP agrees to grant to each spoke a royalty-free, non-exclusive right to any data or inventions developed by the other spokes and any other sublicensable rights that it obtains through other hub agreements. And you'll see what I mean by other hub agreements in the next slide. And in turn, each spoke agrees to grant to MPP a royalty-free, non-exclusive license to any data or inventions that it develops based on the technology that was made available to it. And to the extent that any third-party intellectual property is incorporated within that, the spoke undertakes to make good faith efforts to make sure that such third-party available IP is made available to MPP on the same or similar terms. So those are the IP-related provisions in a nutshell. And this is what the IP sharing process looks like on a schematic basis. On the left are the key players based in South Africa, with Afrigen as the hub, Biovac as the first spoke, as well as the developer of commercial scale batch processes to be shared with the rest of the spokes, as well as the South Africa Medical Research Council, which has received funding from the mRNA technology transfer program to further fund entities such as Wits University and University of Cape Town to do research into second generation mRNA platform technologies and their potential applicability to other disease targets, HIV, TB, malaria, and the like. And each of these entities have already entered into an agreement with the medicines patent pool that contain similar IP sharing obligations that I've just discussed with regard to the spokes. So the idea is that each participant is both potentially a recipient of and a contributor to any technology. And the quid pro quo for agreeing to share your technology is that you're a potential recipient of technology developed by any other members within the network. And I'll close with some thoughts on some real-world considerations that have played a role in certain design decisions within the hub architecture, and this will hopefully serve as a basis for further rich discussions following this session. First is the recognition that we're operating in an extremely competitive IP and R&D environment. mRNA vaccine is not necessarily a neglected field, and there are many third-party players active within this field who do not necessarily share the same goals as the hub participants, and more importantly, are not bound by the same IP sharing obligations that I've just discussed, that are actively staking out their own IP claims within the mRNA quote-unquote commons. And within this type of environment, it is an open question as to whether a pure open source approach, let's say publish everything into the public domain, free for all to use, is the optimal or the most desirable IP management strategy in this environment. Some may continue to say that it is, but I think there are some important considerations to take into account before we make that conclusion, and maybe we can discuss that further in the discussion. And related to that, I mentioned the importance of IP landscaping and freedom to operate analyses. These analyses have already played a role in certain aspects of the mRNA platform technology that is being developed at the hub. So, for example, the types of mRNA modifications that is being incorporated within the vaccine, the choice of lipids within the formulation, all in an effort to help minimize, it won't entirely eliminate, but potentially minimize potential freedom to operate issues further down the line for the spokes. And finally, I think we have to recognize that there is at least a potential tension between the other two principles that I mentioned at the beginning of the talk, sustainability and access. A fundamental pillar of the success of the mRNA Hub program is ensuring the long-term sustainability of each spoke. We want them to keep their lights on and their production lines running when the next pandemic hits, so that they're ready and able to respond in a prompt manner. And if we interpret access to mean the lowest possible price for every single product in every single country, there is the potential for some sort of tension or conflict between those two principles. So a balance has to be struck. We've tried to strike it thus far, but will continue to have to be struck moving forward as both the hub and the spokes progress with their development in their technology. And with that, I will end there. Sorry for going a bit long.
Thank you, Chan, and particularly for I think for the last slide in terms of pointing out some of the tensions that you're facing. Can I now move to Dr. Annette von Delft, who is a translational scientist at the University of Oxford with a focus on infection, immunity, and inflammation, and she is part of the COVID Moonshot Consortium. Annette, please, would you like to share some of your experience? Thank you.
Can you see my slides?
Yes, I can.
Brilliant. So my name is Annette von Delft. Thank you very much for the invitation to talk today. I would like to talk about the COVID Moonshot and the knowledge sharing within the COVID Moonshot. And this was a spontaneous open science collaboration that went from a fragment screen to a drug candidate, and that I've been very happy to be part of. So the COVID Moonshot started very much with the gentleman here on the left-hand side at the Oxford Diamond Light Source called Dave Stewart, back in January 2020, who was offered was contacted by one of his former PhD students back in January at the start of the pandemic, asking him whether he would like to run a fragment screen on a protein that we call the main protease of SARS-CoV-2. And he has got at the Diamond Light Source this amazing technology setup where you can basically map out the active binding site of a protein, and that helps you very much to develop drugs downstream, and this technology is called fragment screening. Unfortunately, the collaborator in China couldn't send over the molecule anymore because everything in China was starting to shut down. So Martin Walsh here expressed the protein, and Frank von Delft to the right of him ran the fragment screen very rapidly. The trouble is, once you run a fragment screen, you end up with quite complex data, as shown here as the active binding site on the left-hand side. You can see kind of the gray protein structure, and then all these different little parts are fragments, which are small parts of the drug that could be made into a drug. The complicated question is how to do that. So very much you can kind of imagine lots of Lego pieces that have to be put together to make a drug. And the team over here wasn't quite sure how to do that. So they were looking for a strategy to make these fragments into a drug, into an antiviral that was orally available, very safe and rapidly and readily accessible. Most pharmaceutical companies that were approached didn't have any interest in antiviral drug discovery at the time. So they looked for an alternative strategy. And it started off with Frank, who ran the fragment screen, making a lot of phone calls to his former collaborators. And within a couple of days, they managed to set up what you could describe as a small biotech company, maybe. They needed someone to run the synthesis of these molecules. They needed someone to contribute designs, and they needed someone who would test the molecules eventually. And Alpha Lee, who's here on the left-hand side at the top, said, actually, I can build a website where people could submit molecules and ideas. Ed Griffin is a medicinal chemist, said, oh, I could look at these ideas and pull the ones out that are most interesting and that could be made rapidly. Tatiana at Inamin in Ukraine said, I could convince my company to make these molecules at cost. And Neil London said, who lives in Israel at the Weizmann Institute, said we could test these very rapidly. And that was very much the birth hour of the Moonshot. And we decided to run a crowdsourcing approach, trying to develop an orally available anti-COVID drug. And the tweet went out a week after the fragment data was was analyzed, calling all the medicinal chemists to submit some ideas on this Postero website that was built very rapidly within 2 days, to put these molecules in, and we then committed to synthesize them and test them and put all the data out immediately. What was born out of necessity ended up with quite a kind of unique data sharing policy. So we crowdsourced the ideas because we initially had no idea how to build a drug out of the fragments. But what came in turn was that all these molecules didn't have any IP assigned to it. So all the molecules and designs and the data was immediately public. What this led to, and what we didn't foresee at the time, was a massive external buy-in. We had hundreds of medicinal chemists submitting molecules immediately, and hundreds of years of cumulative big pharma experience. We even had whole groups from pharmaceutical companies that were freed up for a day a week to contribute to this design, because there was no opportunity to make money from these no IP molecules that didn't have any composition of matter patents. The other thing that happened was that companies like Enamine were very keen to contribute synthesis at cost, and we did have downstream pharma in-kind contributions for ADME and PK. So we were able not only to crowdsource ideas and molecule designs, but also the analysis and testing of this molecules downstream. The other thing that we didn't foresee at the time is that we didn't need any contracts for all this in-kind contribution. And that led to massive time savings within the discovery phase. Everything was based on handshakes and people just contacting us and buying into this no IP policy. And what we also didn't foresee is that the moonshot data would feed into one of the molecules that are actually now under emergency, that are now available in Japan under emergency authorization, Encetravir, which actually cited our data in their paper to show that we contributed to their designs. So that was all we didn't foresee. We also were growing massively, and fast forward to June, we had over 40 groups contributing expertise pro bono and experiments in kind and at cost. And all this was basically funded out of the back pockets of the initial Moonshot collaborators. Up to that point, we hadn't received more than 300,000 in funding, and this was mainly philanthropic funding. And we used existing grants to pay for the synthesis costs, which were at that point the only costs that we really had. And everything was based on a kind of common vision and a quite unique team structure. We had never met in person before. We had very flat hierarchies. We had a meeting once a week, and we agreed our rules as we went. And everything was done over Zoom remote. And this is just kind of a little bit of a summary of where we came from and where we are now. We managed to secure some Wellcome Trust funding in 2021 that was able to bring us from this kind of very early and improvised state from in-kind contributions. This funding should bring us to phase 1 readiness to regulatory approval, and we are still aiming to deliver a oral and safe antiviral. We've just whittled down from our optimized leads to our final compound. You can see here we're in January 2023 at the moment, and still very much at our heart is the affordable and equitable access. And that's very much what we're working on at the moment, this development strategy that we're trying to establish. We are looking for downstream development partners and for a final market authorization holder. And this is probably going to be very much a generic drug from the pipeline. We did have some interest from generic companies, actually surprising interest from generic companies to develop this product downstream and be our market authorization holder. But this is very much ongoing work and a bit of an untrodden path, because usually drugs are not developed without a patent from the start. If we think about what we have learned, we were quite humbled by the massive interest within the scientific community to take part in this open access project. We had a couple of challenges down the line. One was that we didn't have any logistics and any communication worked out at the start. We were laying the tracks whilst we were riding the train, and this was particularly difficult when the Ukraine war started, because all our synthesis was run during the run in the Ukraine, in Kiev. The other thing that we found very challenging during our last 3 years of trying to develop drugs was trying to secure grants without IP. That was surprisingly hard to do, because even public funding is built on the expectation that there will be a return on investment. So universities will only accept grants if there is some way of recouping the investment. So we were very grateful to the Wellcome Trust to fund us in the end with this slightly unusual IP approach. And then the kind of time question, we were able to speed up discovery, but it does still take a lot of time to develop a drug, and it is very expensive. And the more you can invest upfront, the faster you will be ultimately with that drug discovery. So with us running on a shoestring, and we are not necessarily a particularly fast drug discovery effort, even though crowdsourcing can speed up the discovery process, as we have been able to show. The other thing that we've learned is, if we could have done exactly the same thing 17 years ago, the compounds that we develop now would have worked for SARS. So for pandemic preparedness, drug discovery is an absolute necessity. And with that, thank you very much for all the people that have worked on this slightly unusual project. We have got over 200 people that have contributed, and multiple organizations. And thanks for listening to this case control.
Thanks very much, Annette. So I think we're going from the early stage discovery. If I can now move to Dr. Thomas Mboa, who at the moment is a researcher in residence at the International Centre of Expertise in Montreal on Artificial Intelligence, but is also founder of Mboa Lab in Cameroon, which is a collaborative space whose mission is to catalyse local sustainable development through open and citizen science. And Thomas, I think you're going to share with us some of the experience in developing and improving diagnostics using open science and AI. So Thomas, over to you, please.
Okay. Hi, everyone. Can you hear me?
Yes.
Okay, thank you so much. And thank you for the invitation. So the first thing I would like to share with you is what we are doing and the Mboa Lab. What is the Mboa Lab and the emerging technology we are using there. So the Mboa Lab is an open space based in Cameroon, founded since 2017, with the idea to catalyze local sustainable development through open science. But we are focused, sometimes we can call ourselves as makerspace, biomaker space, fab lab if you want. But we are focused and deeply focused on health and molecular biology. That is what we are doing at the Mboa Lab. And in terms of emerging technologies, we can say that we are really working at the level of advanced manufacturing, specifically in two domains, in biotechnology and in advanced digital production. So we are doing, in terms of biotechnology, we are doing a lot. We are specialized in synthetic biology, and with digital production technology, we are using a lot 3D printing. Also artificial intelligence applied to health. But I would like to say that we are not advocating for techno-solutionism. That is why the idea of local manufacturing and distributed manufacturing is very important for us, because from where we are, from Cameroon, from Africa, from Global South, if you want to speak like that, we don't want to be like only the tester of solution. We want to be involved in the design of the solution from the beginning to the end, so that we can be part of the process. And this is part of cognitive justice also we are looking for, or we are advocating for. That is why for us, open science principle and responsible use of technology are very important. It's the core of what we are doing. And we build this ideology based on a lot of work, a lot of existing work, and one of them is related to what I'm doing actually with SEMIA, which is the pole, Montreal pole of the Global Partnership for Artificial Intelligence, because they have two working groups, one on responsible AI, and the other one is in data governance. So they produce a lot of good documents to show how AI can be used in a responsible manner for ethics, trustworthy manner. So that is some of the principle that we are using at the Mwala. You will see that there is a lot of notes related to justice, data justice, community-based approach with the involvement of local stakeholders, because it's very important for us. But also we are working on in the field, we are aligned with what UNESCO released in terms of open science and area of action. But before, I would like to say that I work in the field of open science since more than 10 years ago, and the idea, how we see open science is at 3 layers. So open science is 3 layers of openness. The first dimension is openness to society. The second dimension is openness to other knowledge. And the third dimension is open publication. That is the main trend that people know, open publication. But it's very important to know that what we are doing in terms of technology should be aligned with the needs of local population. And that is one is very important for us in order to contextualize technology, in order to better appropriate this emerging technology. So practically speaking, what we are doing at the Mwala and in terms of our practice related to open science, you will see that we are working a lot with the idea of open source technology to foster and more equitable innovation. This is because we believe that behind the community, we can do a lot. This idea of collective intelligence, yes, is behind the community that we are trying to do what we have done so far is very important for us. And in terms of universal access, universal participation, collaborative production, we are sharing all our protocol, and it doesn't matter where you are, even you are in US or in Central Republic Africa, you can just share your design or your protocol of the direction you are going to do, and you can implement it locally. But it takes like a very good local infrastructure. This prevents us to travel every time to try to get visa to come in Europe or in North America, but we can stay at home in Africa, in Cameroon, and do things like in the same way you can do everywhere. And that is what we are advocating also. And that is why distributed manufacturing, we need local infrastructure to support such prototyping experience and so on, and to support local industry and policy. So, and we are doing also a lot of capacity building, because when we have such technology, emerging technology, it's very important to train local talents so that we can have a critical mass of Africans, of Cameroonian, who are able to work on such technology. That is why I deny or I'm against this this black box just to test solution. That is why people need to be engaged, to be involved in the process since the beginning is very important. That is also the open science and open approach of innovation. We also promote new mode of collaboration because you will see that we are out of the university. The Mboa Lab is not part of the university. It's very important to be out of the sphere or the place where the dynamic of power is very important. But from outside, we have success to show a lot of proof of concept, and we draw a lot of interest from the government, from public university, and we are working more with them also, even if that is a bottleneck, even if they are not supporting financially what we are doing. But the international collaboration is very important because program like this one, this program MAKE is funded by European Union, and is a collaboration between African European makerspace, and we are engaged in this program. So I will go quickly so that you can see in terms of neglected tropical diseases, due to our vision and we are able to work on what we want or on what is important for us. That is why we succeed to develop a new protocol. We succeed to develop new equipment. We are producing enzyme locally in Cameroon, and we sell it across Cameroon and other countries in Africa. It's very important to say that the facilities we have at the Mboa Lab has been put in place with the support of Dr. Jenny Moloyo at the University of Cambridge, and they supported also with the support of Wellcome Trust and other funders. That is what we are doing in terms of using AI to improve the diagnostic of malaria and of the diagnostic of typhoid and malaria sometimes. That is some project that we are doing because we are doing CRISPR typhoid. We are also funded or supported by the Open Society Foundation. And here is our team. Just to finish by saying that all is not fine. I will say we have a lot of challenge, and specifically the main challenge in terms of the chain of fundings, because the main funders, international funders, are funding through state in Africa, and sometimes it's not relevant, it's not the right model. I think we need to rethink the model of fundings is very important, I think. So, and the second thing is there is a lack of interest from local policymakers or on this kind of high level or this kind of emerging technology, specifically when they are outside of this the sphere of powers and so on. So thank you so much. That is all I have to say. I will be happy to reply to any question if you have.
Thank you, Thomas, and thank you to all of our speakers. It's very difficult because I think that there are lots of questions about each of these proposals, and I think for this workshop, what we were seeking to do is to just give an idea of some of the opportunities and challenges. I'm conscious of the time, and I'd like to give an opportunity for some of the people that we have asked to respond, and I hope that we can also get to a couple more questions from those of you online. I think I'd now like to turn to a group of people that we have asked to respond, who come from academia, from the from academia, from civil society. So I'm joined by, and I won't go through everybody's CV, by Dr. Suri Moon from the Graduate Institute in Geneva, by Professor Benjamin Conriat from the Sorbonne University, by Sangeeta Shanskant from TWN, and by Dr. Viviana Munoz-Tellez from the South Centre. I'd like to perhaps start with Benjamin. I think that one of the things that you have done a lot of work on the Commons, which Mariana mentioned, but I think one of the things in your work was to look at some of the principles that existing or future projects could have that could define the Commons. You've listened to 3 examples of approaches where people are applying different principles to try to achieve openness and sharing. From your perspective, are there any aspects there that you recognize that you think could be built on from a Commons approach? Benjamin, you're on mute.
Yes. First of all, thank you very much for this invitation. I enjoyed very much the different presentation. I'll try to answer directly to your question. I was fascinated by the 3 presentations, because I think they bring with them many lessons for us. I begin with a general sentence. To put the right words in the reality is the beginning to understand the reality and to change it. So the right word, in my view, for the 3 presentations we heard, is that all 3 are commons. By this, what I mean, what can we mean? The 3 presentation presents case studies where we have 3 common and basic traits. First one, it's initiatives that are coming from one way or another from the civil society, or where the civil society plays an important role, even, of course, if institutions, states, and so on can add. But without this initiative, it becomes very difficult to do what they are doing. This is my first point. The second characteristics is that they all work on the basis of sharing resources, sharing knowledge, sharing capacities, and so on, through platforms, through journals, through facilities, and so on. But the sharing of knowledge, of capabilities, is key. Third point, which is very important too, is that all these activities work outside of the idea of exclusive intellectual property rights. On the contrary, this sharing of capabilities and so on is based on the idea that beyond the dominant model of exclusive property rights existed a variety of models where property rights can be used to be inclusive, to allow people to share, whilst recognizing to everyone its contribution. It's this inclusive principle of property rights that make possible open access for the others, because you introduce in your way of sharing capabilities and so on, the fact that all this sharing is not for a closed group, but is to elaborate, to share with more large groups, and even in many cases to the whole society, and why not to say it, to the whole world, when it is a question of knowledge. So in these three cases, these three things are shared. Civil society initiative, a bundle of rights that includes the possibility not only to design internally, but to share externally. And finally, we have in these groups something like a governance structure, because this has to be managed, this has to be administrated, and a governance structure that guarantees the openness. Without people guaranteeing openness, the risk for the things to be closed exists. And it is only a battle to find the right way to cooperate and and to share. Let me add another word. We all agree that working for the common good is the best thing we can do. But our conclusions, the work we have done with DNDi and the French Development Agency, demonstrates the following point. Without local commons, in the way we have, in the way they were exposed in the previous cases, you don't have common good. You can reach the common good only if you have commons working for the common good. I'm not saying that only commons can work for the common good. Of course, we need other actors, state administration, agencies, NGOs, and so on. But if at the core of the dynamic, you don't have commons organized the way the different examples demonstrate how they are to be organized, the chance to reach the common good is very low. My hope is that we can be able to share this conviction that to strengthen the commons, to coordinate them, to push them by our joint effort, will open the way to the common good, which is our common objective. Thank you.
Thank you. I think that you're talking about the commons and governance within a commons idea, but a lot of the questions that are being raised and a lot of the work that those of us are based here in Geneva and others are looking at is how do we actually move some of these ideas in a governance system, a global governance system, and perhaps a health governance system, which has shown to be challenged in COVID. And I think it's something that I want to put to all of the other respondents is how do we feel that we can move from some of these concepts and ideas to political action? First, in the context of where we have seen relation to IP, that a lot of these issues have got stuck, or which is a polite term for the discussions that have been happening at the WTO. We know that there are ongoing discussions about a pandemic treaty. From your experience, I'll go to Suri first, and then to Viviana and Sangeeta. Do you feel that if we're trying to move from some of these ideas for a collective outcome to political change, what are some of the issues that we need to take into account as we go into further workshops? What are some of the questions that need to be addressed if we are going to persuade policymakers to make change? So big questions. First to you, Suri, for a couple of comments. Thank you.
Thanks very much.
Turn on the microphone. Thank you. So I really enjoyed listening to all of the previous presentations. Thank you so much for all of the inputs, and it made me reflect on a couple of things that I wanted to throw on the table for consideration by all the participants. We have a ton of people both in the room and online with a huge amount of expertise on this. So I'd love to hear from others as well. The first is around this notion of the common good, the way, Mariana, that you used the term and defined it in your paper. I think that it's a compelling concept, but I worry about the political reality looking at the world in 2023. We heard from Dr. Annette van Delft about how the war in Ukraine has created lots of logistical problems for COVID, for the COVID moonshot, just one of many ways in which, of course, we see a splintering kind of geopolitical reality today. And I think that while I would love to see more global efforts on behalf of the common good, I'm not as optimistic as I may have been even just 1 year ago about the possibilities of doing that, at least in a traditional way. And so I wonder if we might have a better chance of achieving some of the goals that I share, that many of the speakers have raised about the importance of developing health technologies in a way that they are by design accessible and affordable, and that the technology and the knowledge is shared for pandemics. I think many of us here in this event today share that goal. But I wonder if one of the ways to get there is by recognizing that national self-interest is a enduring and very powerful reality that is perhaps even more salient today than it was a few years ago, prior to COVID. And in recognizing that, trying to find agreements, trying to agree on rules where all governments say, this is in my national self-interest to agree on a certain set of rules for the funding of R&D, for the sharing of technology, for the open science kinds of principles that we heard so eloquently described by a number of the previous speakers. But that national governments really agree to it, not because they believe in a global common good, but because they believe genuinely that this is good for them. And I think that in today's world, that kind of agreement will be more enduring and more politically sustainable than an appeal to the common good alone. So perhaps I'm a little bit less optimistic than one should be in January, but that's in any case. I do think we have a very important opportunity though with the ongoing negotiation of the pandemic treaty. I think it's one of the best opportunities we have to actually negotiate and agree on such rules. And I think there is a political possibility to do that, so that ultimately you can serve the common good, but that I'm not sure that that framing alone or the appeal to the better angels of our nature is actually going to get us there. If I can make one observation in wrapping up, it's that listening to the initiatives, the mRNA hub, the COVID moonshot, the Mboa lab, one thing I'm struck by is that these are initiatives that really arose in response to health emergencies, health crises, in response to need. But they're also, in some ways, you could describe them as bottom-up initiatives that built on pre-existing organizations, pre-existing capacities. They weren't created out of thin air, and ultimately you need funding to do these things. You need organizations, you need factories, you need legal contracts, you need someone to hold the dossier, to apply for regulatory approval, et cetera, et cetera. There's a point at which, to me, it's quite interesting to hear the experience of the COVID moonshot. There's a point at which you see there's a need to move from a really beautiful and radical idea for how knowledge is generated to the reality of medicines and vaccines, which is you need money, you need organizations, you need factories, you need someone to take legal responsibility, et cetera. And so what does that mean for these ideas of how to move to better systems for pandemic preparedness and response? I think for me, one of the takeaways from that is you really have to build on, look at what everyone is doing and the actors that are already out there. How do you build from that, and how do you change the funding flows and change some of the rules, coming back again to the pandemic treaty as a chance to do that, so that you shape the activities and the entrepreneurialism and the networks that organically develop from the bottom up, rather than necessarily designing these initiatives from the top down. Over.
Thank you, Suri. And building on that, if I can turn to you, Viviana. I mean, one of the points of the South Centre is to engage with countries, particularly from the South, in helping to try to address some of these questions. And I know that the South Centre has been very involved in the discussions with countries around the discussions here in the WHO of the Pandemic Convention. What you've listened to today, if the aim is to try to take these issues forward, to build a political menu for countries, what do you think countries are concerned about, need to hear, that the organisers need to build on if they want to try, as Suri says, not just to appeal to the better angels, but to try to make a political case? What are some of the issues and questions that you think need to be addressed?
Thanks, Michelle, and thanks to DNDi and also to IPP of UCL for the invite. I think that's a great question because this is something that we're often asked as a developing country think tank. And a general sense, even now in the COVID pandemic, with the discourse around what's happened with both vaccine, but therapeutic production and the inequity, is a sense that, is there anything we can do? Or is this really out of the hands of our countries, even for some manufacturers? But if we don't have the know-how, does it mean we're stuck and we can't move? Do we have to just wait for, big changes in developed countries? And I think the really important message is to say, no, there are so many things that you can do that would have an enormous impact, both at national level in terms of, and this ties up to what I think I take as a big takeaway from the projects we heard is, of course, there is a big issue is with regards to private sector, but when we're thinking about big pharma, how important they are, not just in capitalizing on, let's say, where are potential market opportunities and also the relationships, the networks they can have, and capturing even where innovation is coming from, like from small biotechs, from biops and so forth. But there's a range of players we have to think about, and these projects tell us. It says, we have issues with universities and public sector researchers with huge capacities that are not leveraged. How can we get our governments to also focus on those issues? How do we get those networks of cooperation that can be leveraged through, incentives that are not of the scale that require enormous investments? And if we think about that in cooperation, in particular, even as a regional level approach or through a project-led approach, as we see here, project by project, then there's a lot that governments directly can do. At the same time, this network building does not require a lot of resources also, and it's necessary that as we have multilateral institutions seeking to support this sort of innovation approach that is more public interest led, that they also help us figure out more about how do we capitalize of what we're learning from these projects. And this is nothing new. We've had hundreds of projects that have this different approach, and we're not really learning from that or saying, this is where we need to go. And we don't hear that enough at the multilateral level, or to create that as a practice guide for governments of where should they invest, where should development bank invest, why not in these sorts of projects that can be scaled up. And this is what DNDi also has so much to show, that we really haven't leveraged, I think. So that's one key thing I wanted to mention, that I think while we focus on the problems with big pharma leading, we also need to not leave all the other actors behind, which we could better leverage and bring them onto this conversation as well. And this would also help others that have the question, can innovation be done in a different way? Many doubt that it can be done that there can be real changes. And definitely there is so much to say that this can be done. This is not a conversation of two sides. Let's say when some say it's politicized, this is anti-market, anti-capitalism, anti-profits. That's not the issue. If we really look at innovation systems as the complexity they are, but at project level, and that bringing now to the pandemic situation, and to tell even developing country governments again, when you're considering, can we invest in ideas about, how do we leverage our investments in pandemic preparedness and response? It does not mean that we're asking you to cooperate in investments in a way that will lead necessarily to that same model. We can, by design, create project level approaches that can be different, and just bring these examples more to play in the discussion at the multilateral level.
Thank you. And can I now bring in Sangeeta, and thanks for your patience, Sangeeta. I mean, as a civil society group and a think tank who have been working, and particularly on IP issues, it's the same question to you. I mean, in terms of some of the things that you've heard, what do you feel are some of the realities that need to be further developed if there is to be these proposals for a different way that are put to governments? If you could share some of your thoughts on the areas and questions that need to be really thought through and addressed. Thank you.
So thank you very much for having me on this panel. I really enjoyed, I think it's one of the panels I've really enjoyed listening to, all the rich presentations. I think there are two realities in this COVID-19 pandemic. One is world leaders said we will work in solidarity, and Chancellor Angela Merkel, the French president. In the end, what we saw was a failure of political will at the global level, right? Where each country was really for itself. And I think at the core of it is really the immense power and control, at least in the context of COVID-19, we would have the similar situation for climate change. The power and control of multinational companies, that the power that they wield over political systems and governments. I think this is what we saw. We saw them bullying countries, because they were dealing, they knew they had the power, right? They had the vaccines and they could bully countries into agreeing to what they wanted. So when we talk of the common approach, common good, it has to be backed by international rules and actions. Mariana spoke about the new social contract. We need a new social contract. I think this is very important between business and state. And I think there needs to be more emphasis or more awareness building that actually working towards that common good is actually also each country working in its own interest, right? It's not one or the other. We are all affected by the climate crisis, by COVID-19, by if there is a next variant, we are all going to be affected, right? And we saw the effect of lockdowns on education, the social economic effect following from all the various lockdowns. So working in the common good approach is working in the self-interest. There has to be that realization, and this has to be backed by international rules and action. And I think actually, if you look at the international discussions happening in WHO in the context of the amendment of the international health regulations, as well as the discussions on the new instrument, there are already concrete proposals on the table where developing countries have already begun taking political steps towards unpacking, what it means about working towards a common approach. So one discussion, and this is a very related principle to the common good, is the principle of common but differentiated responsibility. This is a concept in international law related to socioeconomic rights. So the objective is preparing and responding to a health emergency. On the principle, we have all heard, no one is safe until everyone is safe, but the responsibilities are different. So not every state has the capacity to deal with the problem of international spread of disease in the same manner. And the needs are also different, the socioeconomic, based on the socioeconomic circumstances. This is a very fundamental principle of the Climate Change Convention, where, subject to commitments on technology and finance, countries would act. So this is one principle that is actually concretely being discussed in the negotiations. I think there is also the rethinking of rules governing the relationship among governments and also the social contract between business and government. So just to mention a few, there are proposals about creating a legal obligation to cooperate. So the IHR does talk about cooperating, but there isn't a very concrete legal obligation to cooperate. When an allocation mechanism is created, we need to comply with the allocation mechanism, for instance. The right to include in IP legislation clear exceptions waiving intellectual property during a health emergency. Attaching conditions to publicly funded products, right? The condition of sharing those rights. It's about creating new social contracts between business and state. There's also a proposal to operationalize access and benefit sharing, where the sharing of materials and sequences, which are then used, sharing of materials and sequences by governments that are then used for the development of vaccines, diagnostics, therapeutics, these are then balanced with legal commitments from manufacturers to provide monetary and non-monetary benefits. And here, at least on the access and benefit sharing, which is, if you look at it, some call it transaction, but actually look at it is about creating a new social contract between how businesses operate and their obligations at the multilateral level. And there's a very good precedent in WHO in the context of the pandemic influenza preparedness framework that was adopted in 2010. So I think there is a lot of scope to actually operationalize international rules and action at the international level. And I think this is where we need to rethink and place some emphasis as to what can be done at the international level. At the same time, creating that awareness that unless developed countries approach this in a different way, very little is going to change and everyone is going to be affected. I think that awareness, that work has to be done in developed countries as to how they approach, because a lot of the resistance to change because of the relationship that they have with pharmaceutical companies, that is really affecting change. Whether it's for COVID-19 pandemic, whether it's for climate change, but many other crises that are going to be coming. So thank you very much.
Thanks, Sangeeta, for the reality check and the suggestions. We have very limited time. I see, Mariana, you wanted to make a comment. Can I ask you to do it very, very quickly? And then I will turn to Luis and Els. So, Mariana.
Sure, just super quickly, just in terms of what Suri mentioned, in terms of the common good potentially being this fluffy thing, which I agree, it can be fluffy unless we get concrete. The first thing is to, again, change that narrative. So intellectual property rights, they're not rights, they're not God-given rights, they're contracts. They're contracts between two actors that have co-created a system, right? So that's where the deal becomes not a fuzzy point, but it's like, you want to be part of this collective intelligence, right? And kind of both sides, by the way, because I think governments also have all sorts of problems in terms of how they work as well. And we need accountability metrics and so on. But just on the private side for a minute, because that's always the underlying assumption. How do you get the private sector to be interested in the common good stuff? How do you make these deals, serious and not just fuzzy and so on? That's the bit that the more experiments like the mRNA hub, like the AstraZeneca relationship with the Oxford and that kind of COVID moonshot can be examples of co-creation, and where we don't talk about rights, but deals, contracts, intellectual property contracts. You're getting a 20-year monopoly, 17 to 20-year monopoly. That's what an intellectual property right is, right? That's why we have them instead of the Middle Ages where we just had secrecy. You can look at the evolution of why we have them. There's some good reasons to have them, but we've totally misgoverned them. And the deal that the public sector gets for giving a 20-year monopoly has been completely, messed up. So bringing back the language and changing that language and starting with this collective value creation, collective intelligence. And if you want to be part of this machinery, here are the rules. And again, I really appreciated Sangeeta's point on the rules. These are rules for being part of an incredibly, ambitious and dynamic social infrastructure. Even Warren Buffett says it. He's always saying, stop reducing my tax. I invest where I see an opportunity, not just where there's profits to be made. And he says, and I could have never made those profits without this massive social infrastructure around me. And instead of it just being an after dinner speech kind of reflection that some CEOs talk about, the Paul Polmans of the world who are great, what does it mean to then embed that deal? So it's not about, fuzzy common good, let's all, have a harmonious, goal. It's what's the deal to make us actually work together? And I go back to mRNA Hub as an example of the ex-ante pre-distributive deal where we design into the contracts that collaboration.
Okay, thank you. I see that Benjamin, literally a minute, I'm afraid, because we have very limited time. So please make your comment.
Thank you. Yes, I'll be very, very short. 2 points related to the economic models of the commons, because I think it's a real point. One comment in just to say that the money exists. The money exists. BARDA has spent something like $30 billion just for COVID. If you introduce some conditionalities, that is to say, just, okay, we finance, but we have to make public at least part of the results so that other communities can benefit from the common knowledge, then money exists. We have more than we need. This is the first point. And the second point is that if we look to the case of AstraZeneca and so on, economic model based on just cost plus fixing the prices allows to do hundreds of things. So it is true that it is not easy, but my comments are just to say the money exists, we just need conditionalities, and economic models exist. The case of AstraZeneca is not the only one. There are many other ones that we begin to develop in our report done for DNDi. This is my point. Thank you.
Thank you very much. I'm conscious that there's a robust chat going on, and we're noticing that, and want to repeat that this is the start, not the end of a conversation, but we are probably coming to the end of the time that we have today. So can I'll pass over to Dr. Luis Pizarro, who is my boss and the Executive Director of DNDi, then to be followed by Els Terrell, who is part of the Friends of the Independent Panel. Luis.
Yes, thank you, Michelle, and thank you for chairing this session and succeeding to arrive on time. So first of all, I would like to say that we are very, very pleased at DNDi to co-host this panel with the Friends of the Independent Panel. Thank you very much to you, Els, and to the whole team for doing this. I will not come back on what DNDi has done because it has been mentioned by most of the colleagues, the work with Benjamin, Covid Munchert, and of course, all the advocacy work Michelle's team is doing on pandemic preparedness. But I wanted really to insist on three dimensions of the work we do that are absolutely key for this common good approach. First of all, what it's about patient-centered approach. At DNDi, we strongly believe that patients had to be in the middle of everything we engage with the organization. Second is how we share a vision on this common good with all the partners we engage with. We're not doing this job alone. We're doing the collective. So we need to insist on that. And third, the issue of secure, affordable and equitable access through the whole end-to-end R&D process is absolutely key. My only comment here will be personal, is that everything that has been written until now, it's key for the future, but for sure, we need to be very creative in the way we're going to make that concrete now. So we need the political commitment Helen was mentioning at the beginning, and definitely we need to go for concrete policies and practices example to make that happen. So from our side, we're going to continue sharing what we do, but more important, we're going to continue listening and learning from others to help develop proposals, to help share a more open and equitable PPR approach going forward. So thank you very much all for this excellent webinar. Els.
Well, thank you so much, everybody. As one of those friends of the independent panel and also the instigator somehow with some of my friends from DNDi of this workshop, and also working closely with Mariana and working with Helen on the Bellagio meeting that we're planning and the Lancet comment that we published last week. So I'm a little bit in all of these things, but I'm extremely happy. And I want to thank everybody here in the room, online, and the speakers for these extremely rich 2 hours that we've had. A lot of food for thought, a lot of learnings, a lot of inspiration and good questions, and also a lot of work to be done. But I think that we have a great starting point, because as we were saying, a lot of us are actually already working along those lines and trying to move things forward, but maybe not exactly all of us together enough and with a purpose and a goal for the policy change that we want. Because I think we all agree, I mean, more of the same is simply not an option, and this is the moment where we really can take things forward. And so I think what we need is both that high-level policy change, but also the creative exploration and piloting of new ways of doing that. And I was very happy to hear these different examples, and others have said it, those are not the only one. And I think we need to find a way to have those both kind of the top level or high level policy discussions and politics talk more to the concrete experience that people are having. And it's not only about scaling up the experience at a small level, because some things are not scalable, but maybe that's fine. We don't need to only think about one size fits all, the economies of scale. I think we can multiply and be very diverse in the different approaches that we can promote, rather than think there is one solution to fit all. And just want to reflect a little bit, being here at DNDi. As some of you know, I was part of the team that created DNDi 20 years ago. And when we did that, it was exactly the same way. We wanted to show that it is possible to pursue medical innovation for equitable access and use that experience to influence policy change. And I'm very happy that Luis Jos accepted to be partner in this workshop, because this is the same approach, trying different approaches, piloting, learning from it, and using that to influence policy at the highest level. I'm very happy, Helen, that you were able to join us here. Mariana, you're generally working on a different policy level. The Bellagio meeting will also be that mix, and I look forward to working with you all to take this forwards. As already said, this is not the end of a conversation. This is actually the beginning, but it is the end of a workshop. And I thank you all for this fantastic afternoon or morning or whatever, evening, wherever you are. And especially all the people that were online. And Michelle, who stepped in last minute because the planned moderator, Spring, unfortunately, could not be with us because she's ill in bed. Thank you, everybody, for this fantastic symposium, workshop.